I've used Sudafed nasal spray for 15 years. I go through one every 2 weeks and now I literally can't breathe without it. Look, I'm really sorry that this is happening to you. I have never recommended nasal decongestants for this specific reason. Nasal decongestant sprays are things that contain medications like oxymetazoline, xylometazoline, phenylephrine, pseudoephedrine, things like that. They are different to nasal steroids. Now, these medications, what they do is they constrict the blood flow to your nose when you use them, and that helps to reduce the congestion and it helps you breathe. The problem is that once the spray wears off, the blood flow floods back into your nose and the congestion just comes back much harder and much faster. With repeated use, after a few days, the time between doses will reduce and reduce and reduce, and some people need to use them every hour. Now, there are lots of ways to try and get off them. The first one is just to go cold turkey, but that is probably awful and it's going to be really hard and horrible, and it can lead to months or even a year of just distress. Another way to do it is just to stop one nostril at a time. So you stop in this nostril, just deal with all of the horrible effects in one go while you're still using the spray in your other nostril. And then once that one's recovered, stop the other one. And then the third way is just to try and gradually wean yourself off it. Now, if you go to your doctor, we can prescribe other things to try and help it and move it along. For example, we give you nasal steroids, which might be able to just help reduce the inflammation in your nose. And then there are a few other things that we can also prescribe. But if you have any concerns, go and see a doctor.